Hi, so today I'm going to present a clinical case based on the SOAP method. So first we have the identification. We have a female, a Caucasian of 20 years old, born in Mexico, who speaks both Spanish and English. Her blood type is O positive and she's Catholic. She comes in with what is described as an intense cough with blood, as well as breathlessness and chest pain, which is rated 5 out of 10. After a further examination, the doctor comes out with the patient having hemoptysis with 4 days of evolution, mild apnea, and chest angina, and also presents a light cephalea upon admission. For her past medical history, we know that she's had an appendectomy and an ovarian cyst removed. Um, she's a type 1 diabetic since she was 15 and asthmatic since she was 10. She denied any allergies. She has suffered a clavicular fracture and a right ankle sprain, and she takes regular metformin twice a day and albuterol as needed in asthmatic crisis. For her family history, we know that she has had a mom with a type 1 diabetes as well, and her dad died with leukemia at age 53. She has one grandmother and one grandfather alive, and the other two are deceased, one of prostate cancer and the other one because of breast cancer. Uh, the patient takes 3 meals a day, well balanced. She does not do any physical activity, lives in an upper middle class neighborhood, and drinks alcohol on social occasions, mostly wine, smokes around 1 pack of cigarettes a day, and works as an accountant half-time. After checking her vitals, we know that her blood pressure is 135 out of 90. Her respiratory rate is 14 breaths per minute, oxygenation of 80%, temperature of 37 degrees Celsius. After examining her extremities, we know that there's no presence of edema and she has a normal range of mobility. Her neurological and cardiovascular examinations all appear normal, although she does present crackling rail sound on both her lungs after auscultation. So the doctor on call asked for a few laboratories showing a glycosylated hemoglobin of 9.1%, which is high, fasting blood glucose of 205.5 milligrams deciliter, and her thorax X-ray shows a right lung lobe consolidation, as well as her sputum smear indicates the presence of bacteria, mostly gram-negative bacilli and a few gram-positive cocci, which leads her to the diagnosis of community-acquired pneumonia. So the plan is to cure the infection and prevent further complications. So the doctor prescribes amoxicillin, which is an antibiotic, azithromycin, which will help stop bacterial growth, and a paracetamol. The patient responded well to therapy, symptoms were reduced, and she was out of danger for quite some time.